Are you getting stressed out trying to manage your fluid intake? You have heart failure and you've been told by your doctor to restrict your intake to 1.5 litres or less, but you're really struggling. Hi, I'm Dr. Jodie-Ann Senior. I'm a heart failure specialist, and today I want to talk to you about something that causes a lot of stress and frustration for many people who are living with heart failure. Fluid restriction and the words fluid limit make a lot of people feel really anxious, confused, or even guilty. And you're not alone. You're not failing. In this video, I want to help ease the anxiety and give you tools and tips to really help get on top of this. Let's start with why fluid restriction in heart failure really matters. When the heart is weakened, it doesn't pump blood as efficiently, and this can cause backup of pressure in the heart and other organs, which causes fluid to build up in your body. And that's what leads to symptoms like swollen ankles, breathlessness, and even hospital stays. And if you are retaining excess water in your body, say in your lungs, your legs, your feet, then what is happening is that you're holding on to more of what you drink. Let's face it, you won't be retaining any fluid if what comes out of your body is the same as what's taken in. It's that easy. If what comes in is the same as what goes out, no problem. However, if what is getting passed out by your kidneys in your urine is less than what you've been drinking, then you have quite a different situation. And this is a problem. This is what causes fluid to build up, leading to fluid retention, breathlessness, and swollen legs. By limiting how much fluid you take in, you're reducing the strain on your heart and helping your body keep that fluid in balance. A fluid limit is not about punishment, though I bet it feels like that. No, it's about protection. It's also about making you feel better and staying out of hospital and surviving longer. But I know whilst this concept is simple, that doesn't mean it doesn't feel hard. And that's why we need strategies to make it feel doable, not overwhelming. Let's talk about the emotional side of this. Fluid restriction can feel relentless. You might worry about drinking too much. You might feel intense thirst, especially if you're in hot weather. You might get mixed messages. What counts as fluid? What about soup, ice, coffee? Some people avoid drinking altogether because they're so afraid of getting fluid overloaded. Others feel guilt or shame when they slip up. And caregivers can sometimes feel like they're the fluid police. And I bet there's plenty of people who can relate to that. And this isn't good for anyone. Yep, fluid restriction can feel worse than going on a perpetual diet. Here's the thing. Anxiety will feed avoidance and ultimately is not going to help you get things done. Fluid management isn't about being perfect. It's about having awareness and consistency over time. And you are allowed to feel a bit frustrated. Let's call this out so that we can loosen its grip. Now, let's look at some tools that we have that actually help. First, a simple fluid tracking journal. Just a notebook or a sheet of paper where you record your daily fluid allowance and what you drink. You can do it on a piece of paper or in your phone. It creates awareness and self-accountability. Second, there are apps designed for heart failure tracking. Some examples of these are Heart Failure Manager, Medley for Heart Failure, Engage HF, and Treat HF. These let you log fluids, weight, symptoms, and even set reminders. Third, use visual tools like a litre jug on the bench to measure your daily allowance. Something like that. Or a water bottle marked with portions. Rubber bands on a cup. Remove one with each glass. Ice cube counting, or using frozen grapes as a snack instead of sipping. Find what works for you. If you like tech, use it. If you prefer something simple or visuals, use those. I think the most simple thing to do is get a 1.5 litre bottle. Not this is 2 litres, but get a 1.5 litre bottle, say soft drink, milk, whatever, pour that out, or maybe not then, and use that bottle as your guide for drinking. So use the bottle to fill it with water, then use that to drink from in a 24-hour period. That's what you have. It's easy to see and follow and much more accurate than trying to estimate from unmarked coffee cups or glasses. Let's talk about how to stay comfortable. Spread your intake through the day. Start early and sip slowly, and you can use other things to increase your comfort. Having a dry mouth is very unpleasant. On that front, I think it's also important to separate feeling thirsty from thinking you are dehydrated. One is not equal to the other. We were designed to feel thirst to prompt us to drink. Unfortunately, in the situation of heart failure, thirst is dysregulated. You can be very full of excess fluid and yet feel dry and thirsty. And if you buckle and drink, you could drink truckloads of water and still feel thirsty after it. So choose your heart, manage your thirst, and feel and stay well. Or drink too much, still be thirsty anyway, and stay sick and breathless and struggle until you are hospitalized. I promise you, most people get the hang of fluid restriction and do get used to managing it well. It might take a little trial and error, but it is so well worth it. Use cooling tricks, ice chips, sugar-free gum, lemon spray in the mouth, even frozen fruit. It's often your mouth that wants the comfort, not your whole body. Avoid salty or dry foods because they can increase thirst. And be mindful that things like soup, jelly, yogurt, and even gravy often count as fluids too. Watery fruits should be counted by about half their weight in the equivalent of fluid in mils. Oh, and this is important, thirst is not always an emergency. You can feel a bit thirsty and still be safe. That feeling will often pass if you distract yourself or cool your mouth. If you're a caregiver, thank you. Your support matters more than you know, and try to support, not control. Join in the journey, share low-salt meals, learn the same tips, and help with logging if your loved one wants that. Try and avoid blame. If they have a day where they go over their limit, just reset tomorrow. Piling on the guilt won't help your relationship at all, and your loved one needs your support, not parental control. One of the best things you can do is be kind, patient, and encouraging. We are not aiming for perfection, we are aiming for progress. So let's recap. Understand why fluid restriction matters. It's going to help keep you out of hospital. Use tools such as apps, journals, or visuals that make it easier to track. Try cooling strategies and focus on small, consistent changes. And remember, this is a skill you are learning. It's not a test you're failing. If you'd like a free fluid tracking sheet or more resources, you'll find a link in the description below. And if this helped you, please like, share, or comment. I'd love to hear from you. You're not alone in this. You're doing better than you think, and I'm here cheering you on.